Welcome back. Last week in The Art of Dentistry, Dr. Robin Rutherford and his staff talked about DNA testing to determine what bacteria are causing a person's gum disease. This week, they're back with another technique they're using. Beth, Dr. Rutherford, and Dana, thank y'all so much for being back with us today.
Yeah, we enjoyed it.
Yes. Okay, so we touched a little bit last time on some continuing education y'all do, but I mean, y'all do so much with Dr. Rutherford.
Yes,
correct?
yes. You know, we're very fortunate in that he makes sure that if there is something that we want to go learn about, and we're always looking for new technology, there is no question he will send us. We've been all over the United States. Probably a year ago, we went to Las Vegas and we learned about prescription trays, which Beth's going to present shortly. This has been just a huge game changer. Our lasers have been game changers. The saliva DNA testing that we talked about, huge game changer. And the thing about it is we're treating the bacteria, which causes a lot of health issues. People don't realize it's in your bloodstream. It causes your body to not produce insulin properly. It can be a contributing factor to stroke and heart attack.
Wow.
It's any disease is inflammation in the body. So these are the types of things that we're trying to stay on top of to help our patients get the very best that we have to offer.
So Beth, you have some trays you're going to tell us about, right?
Ma'am.
Okay.
Yes. As Dana mentioned, the conference we went to, one of the latest ones we went to, we learned and discovered about the prescription perio tray. This is a take-home device that the patient uses in between professional cleanings to maintain and manage gum disease. It's very easy to use. The patient wears it for just minutes a day. They put medication into the tray and insert it, and literally they can walk the dog, they can take a shower, they can make their bed, they can do whatever they need to with this appliance in. The reason this is important is because the bacteria that causes gum disease is harbored in between the tooth and the gum, and it is positioned in such a way that it's not easy to reach and access by toothbrushing and flossing. So this tray has a special seal system that forces that medication into that pocket and keeps it in place long enough to destroy the bacteria and eat through that biofilm. So it's for some patients, this is just an essential part of their daily care.
So you've seen some good results with
Absolutely.
some patients that we've worked with from that?
The hardest thing about this is just getting in a habit, like anything, getting into a habit of it. But it's super simple to use, and yes, once the patient does use it on a daily basis, definitely, I've seen big results. No bleeding, no tenderness, less tartar.
Tighter tissue, pinker tissue.
Wow. And how often do y'all, is prescribed the right word for this? How often do you prescribe these to people?
Quite frankly, after a patient has been diagnosed with gum disease, which we discussed earlier, is about 80% of the population that has some form of gum disease.
It's a big percentage.
It's a big percentage. So after Dana and I treat that professionally in the office, they will go home with, the majority of our patients will go home with one of these. Not everybody, because it's a customized tray designed for that person's needs. The other added benefit to that is it whitens your teeth.
Wow, that's awesome.
Yes.
Just accidentally, your smile looks better too.
Yeah. How long do they have to use that?
They will use it every day for 15 minutes a day for the rest of their life.
Oh, okay.
Yes, because gum disease is not a curable disease.
Okay.
It is something like high blood pressure or diabetes. It's something that you manage. It's something you control. So, unfortunately.
And y'all have received great feedback from your patients?
We have, because it's easy. It's easy for them. And you know, some people have dexterity problems because they have arthritis. It's hard for them to work with toothbrushes. So all they have to do is just put their medication in the tray and put it in. And the thing too about, the bacteria is we want that bacteria level to be low, because we try to not just focus on the mouth but the whole overall body. So, if you have a dentist and you're happy with your dentist, we really encourage you to go and see your dentist and take care of yourself. If you don't, we would love to have you in our office.
Yeah. Y'all see new patients all the time?
Yes,
all the time.
Okay.
Yeah, and what we're talking about is we just try to stay on the top of what there is out there. Try to continue to be the best at what we do. And I'm very blessed to have ladies like this that work with me that are so good.
Okay. Awesome. Well, thank y'all for being with us today.
Thank you.
Thank you.